In the heart of East Africa lies Uganda, a nation of over 50 million people. Despite ranking as the 31st most populated country in the world, Uganda's health sector faces a crippling crisis. With only 2.946% of the national budget allocated to healthcare for the financial year 2024-2025, the nation falls far short of the 15% benchmark set by the Abuja Declaration, a commitment Uganda is a signatory to. This underfunding has led to severe drug stockouts, inadequate facilities, and a shortage of health workers. Patients often find themselves sleeping on the floor, waiting for care while private hospitals take advantage. Amidst this dire situation, the Centenary Foundation, a subsidiary of the Centenary Group Holding Company in partnership with Cure Children's Hospital in Uganda, stepped in. This organization is dedicated to transforming lives by supporting those in desperate need of health services.
Twajja waneno mu kiwo okuva mu 2019 paka kati omwana ne bamujjanjabako already abadde ku treatment like for 7 years kuba twajjanga she's 3 kati alina 10 ng'ali ku Makerenda. Babadde bamujjanjaba ng'olumu bigendamuko olumu ne bikomawo naye kati ne balaba nga bigaanidde ddala kati okuva lwe bamulongosezza ku Friday tannaba kuddamuko okugwawo bakifusika kwesika. Yeah.
Her epilepsy was a kind which was very poorly controlled despite trying all the types of anticonvulsants and maximizing their dosage. About a year ago, Chua started an epilepsy surgery program from which Davian has been able to benefit from. 5 days ago, she was taken in after doing all the investigations, and since then, we've not yet experienced any seizure. We are very hopeful and we pray that she's going to be seizure-free and live a normal life like any other child.
Ndi musanyufu nnyo beebalire ddala okitukolera bannaaye kuba mbadde sikyalina mirembe nga gyanzigwako.
Many of these children and their families have been facing difficult times in the community. There's a sense that they're cursed, these conditions are their fault, and many of them come with emotional distress, thinking that they're to blame. So we do everything we can to save every child, even with the most complex brain conditions.
Centenary Foundation expanded its efforts to Mityana district, providing essential bedding for patients who previously had to sleep on the bare floors.
I presented a bill of 286 million of critical equipment that we have also applied to other institutions. But so far, it is Centenary Group Foundation which has responded positively.
What you did for us, we cannot even forget. Actually, we had very many focuses. For example, in labor suit, we always have 10 to 15, and you have only 8 beds there. It is not as easy as you may think to tell a client after delivery that you go to the floor without a mattress. But the beds may not be enough. But since we have now enough mattresses, we just give them mattresses and they put them anywhere.
Suubira okusumulukuka olwa environment gye tulimu ennungi. Mufaliso guno gunnyambyeko okusula obulungi. Nemba nga sisobola kutataaganyizibwa nga nzadde bbebi wange.
Nalese wano mulamu wange nga mulwadde ali mu kulubisibwa. Naye embeera ye nasanzeewo si eri ye nasangawo 2023. Nasanga nga emifaliso girimu ebituli nga just mubeeramu omuntu n'waba bulidinzi osangamu omusaayi gw'omukazi omulala naawe ate weebakako embeera teyali nnungi. Naye ate nagenze okujja ate ng'emifaliso gyonna giri bulungi n'engamba ate kino Mityana ky'enempya bw'eti.
Despite these commendable efforts, numerous neighboring districts remain in dire need of medical support from the Centenary Foundation.
Some even come from Kampala back here. Chiboga, they come. So when Centenary group came and Centenary Foundation donated us the 36 mattresses. You can't imagine the amount of joy we had as administrators of the hospital.
As Centenary Foundation, we are proud to associate with this success. However, if more funding were available, we could extend our service to other underserved areas.
I'm appealing to all of you, all our stakeholders, continue working with us as we continue to progress, but also ensuring that we achieve our goals as we've set out in the strategy for the next 5 years.
In a country where healthcare often feels out of reach, the Centenary Foundation stands as a beacon of hope. Their commitment to improving lives continues to inspire a new narrative in Uganda, one where healthcare is accessible to all, regardless of circumstance. Together, we can build a healthier future for Uganda.